Tanning bed increases the risk of melanoma, the most lethal form of skin cancer, by 20%. Skin cancer can usually be treated successfully if it's found during the early stages, but the warning signs for some can be difficult to spot. So here to help us, Dr. Samir Gupta. He is the chair of the Ontario Medical Association's Dermatology section, and he's with us in studio. So first, doctor, what do you make of this new study? That's a significant increased risk of getting skin cancer, 20%, those who use tanning beds.
Yes, and this evidence it's not been new. We've known that the risks of tanning beds for the last few years, ever since the World Health Organization came out with their edict. It's clear, the evidence is unequivocal, tanning beds increase the risk of skin cancer.
Here's yet another study though, right? So do we know, I mean, if you go into a tanning bed once, twice, 3 times, what's the difference or the point at which you increase that risk substantially? Is that clear?
So we know that the more times you go into a tanning bed, the higher your risk. What's happening with these tanning lights is they're inducing mutations in your skin cells, and you can imagine the more times you go in, the more mutations that could potentially occur.
And it depends on your skin type, of course, right?
Absolutely.
If you've burned, specifically if you've ever suffered even a burn as a child, we know that risk, or that increased risk, that does not go away, that stays with you for life.
Absolutely right, Jackie. We know that the sun exposure that you get in early childhood is much more important in predicting later skin cancer. We also know that youth are frequenting tanning beds a lot more in Ontario, and we're really pushing to put a ban on these tanning beds.
Okay, most of us, we're not going to stay away from the sun though, right? I mean, especially it's summer. Summers are short. This year we've been blessed in some parts of the country, but nevertheless. So people with moles, what do they need to look for? Because that's one way where you can see skin cancer, right?
Absolutely. Moles are collections of skin cells, and what we're looking for, what we advise our patients, is to look for a change in a mole or a new mole. That could indicate that something is brewing. Now, this could be a change in size, shape, color. It could also be a change in the symptoms, such as itching, bleeding, oozing. All these things could kind of raise the index of suspicion and perhaps get you in to see a dermatologist to evaluate it. If there is a concern with a particular mole, then there's a quick in-office procedure that we as dermatologists do called a biopsy. We can actually test the mole, send it into the lab, and find out whether it's a beauty mole or a common mole, or it's something more concerning.
You can also just develop a bit of a lesion, though. It may not be a mole that's changed, but just something that looks like a bit of a scratch or a nick. Can you explain what happens there?
Right, so there's a bit of a difference between a mole and a lesion. Moles tend to be the kind of growths that you see early in life. A lot of people are born with moles, and you can develop more moles actually up till the age of 30. Lesions can really present at any time, but we tend to see them more so as people mature. And when people mature, we see these growths on the skin that tend not to be in the mole category, but tend to be in the non-melanoma skin cancer category. And the 2 most important types of non-melanoma skin cancer are basal cell carcinoma and squamous cell carcinoma. They look like growths on the skin that tend not to heal, that may bleed, that may rapidly expand. So they're a little bit different than moles, but I think the take-home message for our viewers is we should be vigilant. We should be examining our skin every few months, preferably after a shower and with 2 mirrors, one in front of you and then a handheld. And
that sounds like a lot of fun for a lot of people. Boy. There's even an app I was reading, an app where you can actually photograph yourself naked. That sounds like great fun, right? I mean, close-up sections of your entire body, but it references changes in your skin, which is very helpful if you're at high risk.
Exactly right. And in this technological age, patients come into offices all day long because we have access to photographs on cameras. So people can take pictures of their moles, they can take pictures of changing moles, and they can bring them into our offices.
Or even just lesions or little sort of, I guess, scabs. Is that the best way to describe it? Drier patches of skin that are not typical to your skin type.
Right. Anything that looks like, you know, we talk about the ugly duckling concept. Anything that just doesn't look right, it could be a dry patch, it could be something that's non-healing, should probably be checked out.
Okay, Dr. Samir Gupta, he's chair of the Ontario Medical Association's Dermatology section. Appreciate this. It's really information that we could all use at this time of summer. We appreciate it. Thank you.
Thank you.